Hiya, this is Boston Wellness. I'm Dr. Penumaka. Today we're going to talk about ganglion cyst. We'll look into what it is, how it's diagnosed, what you can do to help it, and also what are the treatment options you have. Okay, let's look into what is a ganglion cyst. It's usually like a balloon type of thing filled with a jelly-like fluid. Although it may feel tight, it's usually a little bit, you can move it up and down. The usual places you can get is on the front of the wrist, back of the wrist, and top of your feet, and also on the ankles. Sometimes you may get it on the bottom end of your fingers as well. The usual cause for this is because there is a bit of an arthritis in older people, or there's a repeated injury or some kind of repetitive strain in the joints. The fluid that is there is usually from synovial fluid, which is a normal fluid in the joint to lubricate and cushion the joint. Usually you don't need any diagnostic scans or x-rays to diagnose this. A simple examination could help in diagnosis. Once you're diagnosed with a doctor, then how do you treat them? Or could you do anything by yourself? Yes, you can. Most of them are harmless and they go by themselves. However, it would help if you could do some things by yourself, such as you can wear a wrist support or an ankle support to help them. How it helps is it pushes the fluid back in and helps the body to reabsorb. Or you could wear the, again, support to help minimize the movements that is causing the cyst. The other things that you could do is, particularly on the feet, you could wear some footwear that is not going to rub the bump and cause more problems. However, if it is painful and if it is really bothering you and affecting your function, what that means is in order to bend your wrist or bend your foot back, then please see a doctor. They could do a couple of things. One is they could either aspirate or suck up the fluid, or they could do an operation. The benefits of sucking up the fluid is you get immediate relief. However, it can come back up to 10 to 30%. But if they do a surgery, yes, it will go, but there is also a risk of recurrence. However, when they do surgery, there is a scarring and there is issues with scarring and nerve damage because of that. For most people, it just goes by itself and there is no particular harm to these at all. So we'll look at the patient that I have done. The name is anonymized. So Adrian had a problem with his wrist. He's a plasterer, so he got repeated injury, but I think he also got a bit of an arthritis in his wrist. The size of it really tells you what it is. But the issue is that he has very massive ganglion on the palmar aspect or the front of the wrist, which also gives a risk of being very nearer to the radial artery, which is the main artery that supplies your hand. So we have to be very careful when we're draining this, unless you're very experienced in doing the drainage. So I have looked into it. You can see. So I have cleaned the area and put a little bit of local anesthetic or a numbing. Then I have introduced the needle from outside aspect and sucked off the fluid. There is about 20 ml, which we took it off. Then he feels immediate relief and he's very happy. He could bend his wrist, previously he couldn't, but he needs to wear a wrist support to help it not to come back.
How long have I suffered with this now? About 2 years I've had this, and gradually it's started to hurt me when I've been plastering. Okay. So I come here to get it done, and that's the result. It's a damn sight better. and I've got a lot more movement back in it now, and I can wear my watch again.
For more information, please look into our website.